I'm Charlotte Bradbury. I'm a consultant haematologist at the Bristol Hemato-Oncology Centre. I'm clinical lead for a condition called immune thrombocytopenia. This is an autoimmune condition where patients present with bleeding and bruising because their platelet count is very low. Platelets are essential for normal blood clotting. Although immune thrombocytopenia, we call it ITP, is a relatively rare condition. It has a lot of similarities with other autoimmune diseases, which have a total prevalence of 3%. Similar to other autoimmune conditions, first-line treatment, the standard of care is with steroids. And we face very similar challenges in that patients' responses are very variable. So 20% of patients don't respond at all, and only 50% have a good response, and only 20% maintain a response when the steroid dose is dropped. Unfortunately, this is not without risk because when patients don't respond, they're still at risk of bleeding and bruising. They have to attend hospital very frequently for monitoring, and they're unable to work or get on with their lives. In addition, the steroids themselves have really bad side effects, and 98% of patients will report at least one side effect. Therefore, the problem is that we need a predictive measure of response to steroid before we start first-line treatment. This would mean that we could choose more effective treatments earlier in the patient pathway if patients were predicted not to respond. We are looking to collaborate with a research laboratory to help us answer this question by setting up a laboratory assay that can measure responsiveness to treatment before the patient is clinically started on it. We think this will hugely improve patients' lives because for the duration that they have a poor response and their disease is not controlled, they not only are at risk of bleeding and bruising, but they have to frequently attend the day units, and their whole lives can be put on hold for months on end. We think that this would hugely improve both the patient experience, but also will reduce the workload on the day unit and clinics.